the simple things in life. Either it does or doesn't feel right. It's the simple things in life. Come on, baby, let's ride.
Good morning, guys. Happy I don't even know what today is. Wednesday, 7/11. I have my new appointment with the rheumatologist. I have to be there at 8. Leaving early because I don't know the traffic, like, because of school. So I'd rather be early sitting in the parking lot than late. So I will definitely try to record. I'm not, it's the first appointment, so we'll see. I'm excited. I've just been praying that me and this new doctor, me and her can have a really good relationship and, get understanding, because I really feel like it's time for a new treatment. Don't know what that new treatment will be, because CellCept alone is not beneficial for me right now. So I'm looking forward to getting some relief, because something is going on with my joints that is more than like the normal joint pain. I'm getting more swelling, and I really want to be, tested to make sure I don't have like rheumatoid arthritis or something. Something went wrong like after the back surgeries. So, I just want to know what's going on. But I'll come back, guys. So I'm here. It's like 7:43. I don't know what time they open. I see like a receptionist in there, but y'all know I'm just lazy. So I'll get out of the car at 7:50 and see if the door is open. I know my old rheumatologist, they were open at like 7:30, and they're probably the same way, but I don't know. I'll just wait in the car patiently until 7:50. Because there's a car parked in like a handicap spot, and there's no one in it. So I'm assuming they may already be, open. But I already have my paperwork filled out, so that's a good thing. I have my hair like this because I have a hair appointment today and had to wash it last night. So I have it in my little plaits to dry, which I don't think is going to be dry. It's not. But we're going to have to make it work, because I was thinking my appointment was on a whole different day. And then when I found out what day it was on, I didn't even feel like doing it on Monday to wash it. It's just whatever it is, what it is. Because I think, to me, my hair works better when it's wet, when I do twist and stuff. Excuse me. So I'm assuming, hopefully we can work it out. But I'm having to drive to Alabama. But first, I'm going to go to the hubby's cardiology appointment after this appointment. And then head to Alabama. So today's going to be super long. I'm working on oxtails. I marinated them last night. So when I get back, I told him that when I get back, I might put them in the crock pot versus on the stove. But I really don't want to. Because I got the recipe, once again, from Cooking with Gina. And she did them on the stove top. So I really want to do the recipe exactly how she did it, so I can see how it works. And then maybe in the future I can do the crock pot method. But I want to try to do, follow the instructions as are. But I think they're going to turn out really, really good. So I'll come back.
Cheryl,
Yes,
this is
ma'am.
Etheredge. How are you today?
I'm okay. How are you?
I'm all right, thank you. So you have primary doctor Since you did send us some records. What's your understanding of why you're here and how can I help you?
I needed a new rheumatologist. I was seeing Dr. And I don't know if it was a misunderstanding. I called their office to try to get like a working appointment because I was on Benlysta. He had stopped it in June because he thought it was attacking my lungs.
Okay.
But since I've been off, my stomach has just not been right. And so I called their office for a working appointment, and I said, hey, I've had to stop the cell stuff on Sunday, having numbness in my face. And they were like, okay. No one called back. The next day, called back to the nurse, and she was like, let me get the message to her. And then by then I got put in the hospital because they thought I had stroke because of the numbness in my face and everything.
Where were you in the hospital? Did you have a stroke?
No, they said it was a complex migraine. I don't believe so. And I've seen my neurologist since then.
Who's your neurologist? Okay.
And she wanted to find out if it was something with my lupus that's going on neurologically, or what. But in the interim, while I was in the hospital, Dr. said, well, she wants to discharge you from the practice because she doesn't feel she can treat you and you're treating yourself. And I was like, well, I can't keep anything down. I can't take the cell stuff. I'm sorry. So.
Okay. Let's go back to 2004. That's when you were diagnosed with
14.
lupus? I'm sorry.
Sorry.
No, that's okay. When did you develop symptoms that were diagnosed as lupus? Looking back, how long ago?
I think I started really noticing, I've always had issues where I was fatigued, sun sensitivity, as a teenager. But I ended up having kidney failure in 2012, and I had 2 back surgeries that same year, and adrenal insufficiency. And it seemed like from that point, everything just...
2 back surgeries? Kidney failure. What did we figure out about that?
They didn't know.
Okay.
They were trying to,
Were you hospitalized?
Freeze.
Okay.
I was in there for like 5 days, I think.
Okay. Did you have a kidney biopsy there?
They never did the biopsy.
So you had 2012, kidney failure, 2 back surgeries, and then...
Adrenal insufficiency.
Who said adrenal insufficiency?
It was after the last pliff on my back. As soon as they brought me in the room, my heart rate was sky high. And they did the cortisol.
So it was immediately,
immediately
post-surgery. So what happened about that?
They just did the stuff, sent me to the endocrinologist. The endocrinologist said everything looked okay once I got in. So
okay. So then what? And how was lupus diagnosed?
My back, the issues with my back wasn't getting any better. I started losing like muscle mass. I was having weakness. Like they would, check my reflexes.
So your back still hurt?
Oh yeah.
Okay.
And so my pain doctor at the time was like, something is not right to why you're not getting better. So at that point, he did the ANA and everything.
And it was positive? So the pain doctor did the ANA. Okay. And sent you to Dr.
Brown.
Who was the pain doctor? Okay. Is he around still?
I think he came back, but he was gone for a while.
So what did Dr. do?
She repeated, I guess, more lupus panels. She questioned my symptoms and decided that yes, it was lupus. And she did mention something that if it wasn't lupus, it could have been mixed connective disorder.
All right. So what other symptoms did you have?
Oh, I have the chronic fatigue, daily joint pain, swelling. I get the butterfly rash. Currently, I do get hair loss now. That's just started within the last 6 months.
Okay. Did you have it before or hair loss in the past 6 months?
Yeah.
Okay. And what else?
It's pretty much attacked my lungs. I was on oxygen for 18 months. And
you're seeing now. Have you seen him long, or is
that's recent.
Okay. Now it looks to me like from his last note, he's planning some testing. Or is that scheduled or has that happened?
He wants to send me to Treasury Care Center because he said he doesn't really trust the cardiologist. He thinks I have exercise-induced pulmonary hypertension.
Okay, where does he want to send you?
UAB, I believe.
Okay, what joints bother you?
Currently knees, shoulders, wrists, fingers are swollen.
Okay.
My feet, like the top of my feet, if I can drop a pin on it, it feels like I just dropped a bowling ball.
So, knees, shoulders, wrists, fingers. Where in your fingers?
Mainly in this area.
Okay, and what about your feet?
It's like the top of my feet are really sensitive. So like if I drop a pin on it, it feels like I dropped a bowling ball.
Okay, alright. Are these joints swollen?
They do swell. But my hands more so than any of them.
And then you're tired too.
Oh yeah.
Are you running any fever?
Occasionally, not a whole lot.
And how about your skin? Do you have any active skin rash?
I get the ulcers and like the vag.
And in your mouth also? Where in your mouth?
No, it's like right on
In your lips? Alright. What about numbness and tingling of the fingers or toes?
My feet stay numb. My fingers in the right hand are numb. Like my whole right side is just not normal. And no one's been able to figure that out. Where I have
whole
weakness,
right side?
Yeah. Because I still have the numbness from when I was in the hospital. So they're still trying to figure that out.
So you think your right side feels weak? You mean like you don't have strength in the upper and lower extremity? Okay. All right.
And when you're trying to like do the difference in touch, it's way different on the right than it is the left.
And that's the upper and lower extremity. And what kind of testing have you had for that? Probably
just
MRIs.
MRIs. And
what about neck?
I just had a neck X-ray, and a shoulder X-ray.
Okay. All right. And so your treatment for lupus has been through Dr. And I know you say you had Benlysta. You were on it for 2 years.
Because the first bout, when she started in 2015, I was on it maybe like 3 or 4 months, and I was having some shortness of breath. But at the time, she was like, let's stop it because we don't know.
Okay.
But later that year, that's when I got put on oxygen. And so she put me back on it because she was like, well, I don't think that's the cause.
Okay. And is new to you?
Yeah, within the last...
Who put you on oxygen? Did you have a different pulmonologist?
When I was in the hospital, I go home with it, and then I saw a doctor.
Alright. And so the hospitalization, was that when you had the kidney failure?
2012, yeah.
Yeah, and was that is that when you had, 2012 is when you had oxygen?
No, oxygen was 2015. 2015 to 2017.
What were you in the hospital for in 2015?
The oxygen. I went into this, and I was just like, hey, I really don't feel good. I can't breathe. And she had my pulse ox, and it was like 87.
Okay. Okay. All right. And last Benlysta now was when? Did I see June? All right. And you mentioned Cellcept. What other meds have you had?
Plaquenil.
Okay.
And I was only on that for like 3 months.
Why?
I lost like 70 pounds. Like I was so sick on it.
Nausea and vomiting?
Yeah.
Okay. All right.
Diarrhea.
Okay. And then, so you had Plaquenil. Did you have steroids? They give you prednisone?
She would occasionally give me a Medrol dose pack.
Okay. What about methotrexate?
No, she never tried that.
Anything else?
Okay.
All right. And let's see. Other health problems have been low thyroid. Let me see your med list first.
It was when I
You're on
had my
Cellcept
son.
now. Who prescribes that for you now?
Dr. Luckett, you know, with you.
Norco? Who prescribes that?
Dr. T. She's,
Okay. Diclofenac gel, lidocaine gel, baclofen. You've had low thyroid? Or had that? You're not on thyroid?
Not on it now.
Okay. All right, and let's see, sciatica, and you've had 2 back surgeries. Childhood asthma. Kidney failure resolved.
I still have constant like kidney pain. I just had a renal ultrasound on Monday, so I don't know the results of that.
Do you see kidney doctors now?
It's Sjogren's
Sjogren's
and Raynaud's. I put it on the last page.
Yeah, I did see that. So tell me about Raynaud's. What do you know about that?
Well, my
Can you
hands
describe it to
get
me?
severely cold and kind of turn blue. It's painful. My feet do the same thing. I'm constantly have a electric blanket.
Do they get white?
Yes, white and blue. And it normally, to me, it happens more like, it's worse when I'm in a flare.
Okay. Are you having that now?
I feel like I've been in a flare, to be honest, for like the last 4 months.
Surgeries that you've had, what'd you have, laparoscopy?
I had endometriosis.
Okay. Hysterectomy, why did you have a hysterectomy?
Same for the endometriosis, and I kept having.
Do you have your ovaries or are they gone?
They're gone. I kept having cyst rupture.
Okay. Gallbladder removal, 2 back surgeries.
Then I had a spinal cord stimulator that was separate. They put it in and took it out, so I don't know if that's
2014 and removed 2015. Okay. How many pregnancies?
3, but 1 child.
And so, one was miscarriage, one was. You do have a pain management doctor. So you have a half sister who is treated for polymyositis. Migraine headaches.
Yes.
So, your stepdaughter lives with you. Where does your son live?
In Virginia, what is that? He's 17.
Disability based on lupus. Were you ever a cigarette smoker?
No.
Alcohol? No. Exercise? Fairly inactive?
Yeah.
Okay, a few more questions and then I need to examine you. What's your weight doing these days?
My weight? Not good.
Is it going on the way up or is it just?
Well, it's staying consistent, but I've never been this heavy until getting diagnosed.
And fever, you say occasionally. Do you currently have any skin rash? But you do have some problems with scalp hair loss. Do you have any mouth ulcers currently?
No. And I do like a medicated shampoo. I pretty much can't put any heat on my hair. And of course, if I'm in the sun, like it'll just break out and like blisters.
Do you have bald patches or just thinning?
It's just thinning.
Okay.
Like when I comb, it's just coming out.
Okay. How often are you having headaches?
I really don't get the actual migraines. Like I wasn't getting them, but like maybe once every 3 months. But then this whole complex migraine thing, and it just didn't feel like a normal migraine. So that's why they're kind of questioning if it was part of my lupus.
Do you have pain in your chest?
Occasional chest pain, more just shortness of breath. My heart.
What's the chest pain like if you have?
It's just like a achy, cranky feel.
Okay. And how about any trouble with swallowing?
Yeah.
And what happens?
My pills are getting stuck. I'm getting choked with water. So I see Dr.
GI doctor?
I'm scheduled for an endoscopy and a colonoscopy.
Have you ever had those before?
Yeah. So I'm scheduled next week.
So you've had both of those before?
It's been a while.
Were there any abnormalities found when you had those done?
Colonoscopy, once they said my colon was kind of fixed because of the endometriosis.
Yeah, right.
And then they found a hiatal hernia, incidental. So
Right.
no issues.
How's sleeping at night?
Horrible. I may get 2 to 3 hours.
And how long has that been the case?
It's always been. Doctor used to give me like a sleeping pill. What if it was Lunesta?
How do you feel in the morning when you get up?
Like I haven't had any sleep. Getting up is very hard. It's like my joints are really stiff.
Okay. Okay, so you brought some lab work with you,
That was
and this
last
was done
month.
9/25/18. Thank you. Or you want these back? Or
No, ma'am, you can have
who ran these? Were they in the hospital?
them. They were. I told him I needed a new lupus panel.
Okay, may I examine you? All right, just stay right there. Can you show me your scalp?
Sorry, I just washed my hair, so
That's
it
all
was
right.
still wet.
So show me where the hair loss is.
It's just all over because my hair it's long, but it's breaking off.
Okay.
I'm sorry.
That's all right. Okay, tell me if you have tenderness here.
A little bit on the
Look
right.
up toward the ceiling. Down. Okay, and open your mouth. Okay, good. Does this hurt when I press it?
The right side.
The right side hurts?
Everything on the right hurts.
Okay, all right.
So
Let's
it's like,
have you lean forward a little bit and breathe in and out. Good. Now just breathe quietly. Good. Oh, I'm sorry. You have tenderness when I do this? And what about in here?
a little bit.
How old are you now?
37.
Okay. Does this hurt?
It's just sore.
And here?
A little bit.
Okay, I feel it.
Really hurt. This knee hurts super bad. That's new.
Have you had x-rays taken of your hands and the areas that hurt?
Just the shoulder and neck recently.
Does this hurt?
Yeah.
In here. Just move your shoulder. That's okay. And what about on this side? Do these areas hurt?
I mean, it hurts like when you rub it along.
Yeah.
It's, I don't know, it feels like my bones are like bumpy. I'm like, maybe that's normal. I don't know.
Okay, can you put your arms like this and resist my efforts to push down? Good. Okay. And show me this. Can you take your right leg and cross over your left? Does that hurt anywhere? Where does that hurt?
It goes
In your knee?
up my knee and it's in my
All
back.
right. And what about the other side?
I mean, it's just.
Not so much. Okay. All right. So, let's see. I do have Dr. records. And so I have what he has. I don't have anything else. And we need to just start over.
I understand.
So what I propose is to send you for current blood work.
Okay.
I'll also request records from Dr. And I will request records from the recent hospitalization at, and I don't know if they'll go back as far as 2012 and 2015.
Okay.
But I'll try to get those as well. In the meantime, I guess just stay on the same medications.
Okay.
I don't propose to write your prescription today, but I'll see you back soon.
Yeah.
And then we'll go over it.
Okay.
All right. Any other questions today?
No.
Okay.
I'm thankful that you were able to get me
Happy
in.
to see you. So you wait here. We'll be with you in a moment.
Okay. Alright guys, so the appointment went okay. I mean, it was fine. I did record. Their office is pretty dated. They still use paper charts, and she writes out her notes, so I thought that was kind of strange. And they leave the door open. She closed it when it came time to examine me, which was kind of strange. I'm like, you've had the door open the entire time. So, and I thought it was just like maybe she forgot, but then like going down the hallway, like the other doctor that's in there, they do the same thing, and I don't understand that, but whatever. I'm not trying to be picky right now, but I was just thought that was weird. So she gave me a slew of labs that I have to get done. She's like, look, we're just gonna start over. And I said, thank you, I'm okay with that, you know what I'm saying? So she's not going to change any of my medication or add anything until she knows, based on the lab work. And I thought she said she wanted to do x-rays, but I didn't look at the paper to see if it was on there, because the girl just said labs. Yeah, these are just lab work. So I'll get these labs. She wants me back in 3 to 4 weeks, which I'll go back November the I think the girl said November the 8th. So I'll get these labs done next Wednesday. I just called the hospital and moved my Metaport flush to next Wednesday, because originally I had it scheduled, because I have my colonoscopy on the what do you call that day? I have my colonoscopy next Thursday, and I was gonna just go and get my Metaport access that day, like 45 minutes before the procedure, but they're always behind, and I don't want to miss my colonoscopy, even though it's in the same hospital and building. So I just called and moved it to that Wednesday. So I'll get these labs work done Wednesday, and have my Metaport access, and it'll just stay accessed until after the colonoscopy is done. So she seems really like she's nice. She really wasn't as, talkative or anything, besides she asked a whole lot of questions to see how I got to my diagnosis and all of that stuff. So she seemed pretty thorough, like even on her exam. Like she was doing stuff that the other rheumatologists never did. Because all my other rheumatologists ever did was touch my hands and my wrists and say, oh yeah, your hands and wrists are really warm and you got some swelling, and that would be it. So like she was like looking at my eyes, like pulling my eyes down, doing all kinds of stuff, and I just told her my right side is just still not normal. They don't know what it is. They wanted me to see her first before we could figure out like to go other steps. So yeah, I'm praying that we can get on some more different treatments, because she's like, well, have you ever tried methotrexate or anything like that? And I was like, no, never tried anything else. And I forgot to mention that they tried to give me that sulfasalazine or whatever, but I forgot about that one because I didn't take it. So now heading back to the house. It's 9 o'clock. I'm tired, but hey, you gotta keep pushing. Can't do nothing about it. You're always gonna be tired. So, well, we're always gonna be tired as far as autoimmune disease is concerned. It never stops. Yeah, so I'll come back a little later on. Alright guys, so I am now finally heading to Alabama. It's like 1:40. I'm supposed to leave at 1:30. But I'm making a lot of changes with my husband's medication. We both got to make lifestyle changes to lose weight and eat better than what we do. But yeah, they're making a lot of medications. He's got to get an echo of his heart, and then some lab work in a few weeks to see how the things are. So just be praying for him, because he's currently on like 5 blood pressure pills already, and it does not control what's going on. So he has a very strong family history of high blood pressure, diabetes, and aneurysms, heart attacks, and so, but we know God's got us, and we just got to do our part to take care of our temple that God gave us. I have to pack. I have not packed not one item for this retreat. Even though it's overnight, I haven't done anything. So I've got to get that going. Got to work on some track stuff since I'm not going to be there. So I'll come back once I am there or done.